Hi everybody and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kaigenesis and of the Kidney Disease Solution. And today I wanted to do a video about treating kidney disease in our family, furry friends and our pets, in cats and dogs. So let's have a look at that, because we often do get emails asking whether anything that's in our programs or anything that we do will pertain to animals. If you're hearing this noise in the background, I'll show you. This is Hugo. He is my brother-in-law's Doberman. He stayed for the night, so he's outside so he doesn't disturb me, but he's going to just sit by the window and cry. So I apologize if there's some background noise here. So let's start by having a look at kidney disease in our animals. So so kidney disease affects about 1 to 3% of all cats and about 0.5 to 1.5% of all dogs. And it's actually one of the leading causes of death in cats as they age. So it is actually something that's really great to know about, things that you can do to treat and actually things that you can do to prevent declining kidneys as our pets get older. In dogs, it's going to be the Samoyed, the German Shepherd, the English Cocker Spaniel, and the Bull Terriers are actually more prone to kidney disease. And in cats, it's generally the Persian type breeds. But in reality, if the conditions are right, any of our pets can go on to end up with diminished kidney function if we're not careful or if we're not doing the right things for our pets. So what is different in our animals is that we obviously can't do, or we don't tend to do, kidney transplants and dialysis for our pets. So when we're looking at how to treat kidney disease, it's very different for pets versus our human friends. And also that I think preventing kidney disease in our pets is something that we should really, as pet owners, be really thinking about, because it's harder for our pets to tell us when there's something wrong. You know, animals are very stoic by nature. They don't tend to tell us when things are going on. And ironically, most dogs and cats in kidney failure produce actually huge quantities of urine. It's not that their urine flow diminishes, which is something that people would often look for. And unless you're having annual routine blood tests, diminished kidney function can often go completely unnoticed by pet parents unless you absolutely know what you're looking for, or unless it gets caught up, it gets tested and caught just as a offside when you're having other bloods done. So early detection and renoprotective treatments are designed to slow the progression and the loss of damage to neurons. So let's have a look at some of the symptoms that we'll see in our animals. And again, like I mentioned, it's really hard. Even humans, you know, we often I have patients come in and I'll be looking at blood tests and I'll be like, did you know that your kidney function is stage 2 or stage 3? And they'll have no idea, because it is one of these silent diseases, and it's exactly the same in our pets. And that's one of the reasons that I am a massive advocate of having annual checkups, especially as your pets get older. I'm looking because the dogs are out here. We've got Apollo and Hugo out there. And it's one of the things, Apollo's only 7 months old, but he had one at 6 months, but he'll have annual checkups that I run his blood test so I can see what his kidney function's doing. And that way you can pick things up well before they and symptoms actually appear. With my elderly Doberman Ruby, who passed away in last September, we were running annual checkups with her all the time. And that way, you know, I can monitor her to make sure her heart and her kidneys and everything was okay. So one of the earliest clinical symptoms that you can look out for in your pet is increased water consumption and increased urination, which is called compensated renal failure. So after approximately 2/3 of the kidney tissue is destroyed, so 2/3, so 75% of the neurons and the nephrons, have to be destroyed. And then there's this rapid rise in waste products in the bloodstream, and then the apparent onset of severe disease. So you won't see kidney disease in your pets appearing very symptomatically until they're about in 75% failure. So that's why it is so important to test beforehand. So clinical stages of more advanced kidney failure will include things like loss of appetite. Your pet may become depressed, vomiting, diarrhea and or constipation. Bad breath is definitely something to look out for, especially if it gets quite a sweet smell about it. And that could also indicate diabetes. Your pets may start to lose weight. They may lose muscle mass because of the way that you've got increased protein coming through the urine. So If you find your dog, your cat is muscle wasting, especially around the back end, that's something to look for because that's where you're likely to see it first. Blindness, blood in the urine. They may get little bruises around their gums and teeth. And mouth ulcers, which it doesn't happen in every pet, but if you're starting to see mouth ulcers as your pet gets older, definitely worth getting their kidneys checked. They may become weak. They may be more prone to skin itchiness and bone fractures. So if any of those things are appearing in your pet, I highly suggest you take them straight off to the vet now. And your vet will use something called the IRIS, the International Renal Interest Society staging system. And it's based on the serum creatinine levels. And then you've got this substaging, which is based on the presence of protein in the urine. So I wrote a blog post about this, and there's actually an image on there that goes through all the different stages. So again, one of the things that your vet would do is then you're going to collect urine from your pet, and then we're going to look for the creatinine and if there's too much protein in the urine. So causes of chronic kidney disease in pets. Well, there are quite a lot of potential causes for kidney decline. But one that your vet probably isn't going to tell you about, and one that doesn't get spoken about much, is the impact of diet. So dried commercial pet foods are a pet hate of mine. And that's mainly because the pet food labeling in the US, and I'm pretty sure in Australia as well, it's not regulated. So what ingredients they put on those Ukanuba or whatever brand it is, it may not actually be true. So you may think you're feeding your pet something and the label says one thing and you may be feeding it another. You've got to remember that every chemical, binder, filler, which all these commercial cheap dried pet foods are filled with, processed through the kidneys, and it's the kidneys that have to take out all of those contaminations. So if your pet has had a lifelong diet of dried kibble, that's going to add strain to their kidneys, and it's also because they have to drink far more water to compensate for being on dried food. Actually, in the wild, our pets eat a very, very high moisture-rich diet. In fact, about 70% of their moisture is picked up through their diet from eating raw prey. When you have a dried food model, they're missing out on all that moisture. And that is part of the reason that the kidneys are put under duress if they're on a lifetime diet of that. And again, the other thing too is that I guess if you're feeding your pet a commercial dried food every day, for me, that's the equivalent of feeding your pet McDonald's or KFC every day. And you, as being a human, know that if you were to eat the same thing day in, day out, dried, highly processed kibble, what that would do to your body. It's no different to our pets. In the wild, they would eat a raw prey food sort of model. And I kept looking at Hickson dogs walking past the window, but that's what all my dogs have always been fed. They're on a raw, what we call prey diet. So they get whole animal and things like that with vegetables. And then I do things to make sure that I'm looking after their microbiome and anti-inflammatories and those sort of things. So I stay away from any kibble, and if I do feed any kibble, it is dehydrated, raw, dry food, things like Ziwi Peak. I'm trying to find the other brand. It's sitting just on the table over there, but I may use that as a bit of a topper. So, and again, that's dehydrated protein. So then they'll still be having to drink a bit more water because that is dehydrated food, but my dogs only get that as a treat or a topper or something like that. So it definitely doesn't make the bulk of my food. So yeah, as you can tell, then I'm going to be a massive advocate for a whole raw, natural, moisture-rich diet, but I'll get to that a little bit more in a moment. Other causes of kidney disease in cats and dogs can include things like bacterial infections that can get down into the kidneys, chronic high blood pressure, poisoning. We often see, if a dog's or a cat's been baited, they go into acute renal failure. Urinary blockage, so if they've got urinary stones and things like that in there, is more common in pets diagnosed with lymphoma. Same as humans, if your cat or dog has got diabetes, they're going to be far more prone to kidney disease. Again, same as in humans, certain medications, including the non-steroidal anti-inflammatories, which might be used if your animal has arthritis, and some cardiac medications and some antibiotics. There is a familial renal disease, so hereditary, chronic long-term inflammation, which can come with a lot of conditions and diseases that our pets can get, like arthritis and other things like that. And chronic low levels of vitamin D can contribute to the onset of diabetes in pets, which then in turn can set off kidney disease. So when you do your annual checkups, it might be worth just checking vitamin D levels in your pets. And vitamin D in pets is a whole other sort of thing. They really have to get it through their diet because of their coats. They don't absorb vitamin D the same way humans do. So things like sardines are a great source of vitamin D for your pets if you need to get that in there. So if you want to see what your pet's kidney function is doing, there's a couple of specific blood tests that you can ask your vet to run. One is a complete blood count. Hello, Apollo. Do you want to say hello to everybody? Yes, darling. So, and a healthy kidney function is required to produce erythropoietin. And so changes in kidney function can lead to a decrease in the production of this substance, which then will in turn lead to a decrease in the number of red blood cells that's produced by the bone marrow. And that may show up on a test as the animal being anemic. So if you've had a test come back and your vet said, oh, I think, you know, Apollo's anemic, we're not sure why, I would then be saying, can you please run further tests into my pet's kidney function to make sure that that is not a cause of the anemia. Serum Biochemistry profile is another test that can pick up changes in your pet's kidney function. This test shows your pet's blood urinary nitrogen levels, or BUN, as well as their creatinine levels. So both of these two substances are normally cleared from the bloodstream by the kidneys, and therefore they're a really great indicator of how well the kidneys are functioning. So an increase in either BUN or creatinine is often seen in kidney disease. It can also be seen in things like dehydration. So anything that reduces flow of blood to the kidneys, that will show an increase in BUN and an increase in creatinine. You can then do, as I mentioned earlier, a complete urinalysis, and that's actually quite essential. So that's when you'll need to get a urine sample from your pet, and that's when we're looking to see what's in the urine, making sure there's not too much protein in there. We're looking at ketone bodies. We can see diabetes in there, and we can also see if there's blood in the urine, which will be an indicator as well. And occasionally, if all of those seem to be okay and you can't find anything else, then sometimes we'll do an ultrasound or a kidney biopsy is maybe recommended when, you know, you just need some more information. So treatment of kidney disease will very much depend on the cause and the severity of the disease. Because your vets aren't going to be doing things like dialysis and kidney transplant, they're then generally using medications. And so that'll be things to lower blood pressure if it's high, monitoring and treating things like diabetes. They can use fluid therapy. So they'll often run an IV through the pet to really help hydrate the pet. They'll use things like ACE inhibitors. And then probably the major thing is they'll use renal diets, but they are dried commercial foods. And so my problem with renal diets and doing it via dried commercial food is, yes, it may lower some of the protein and it will lower some of the phosphorus, which is a big issue in pets with kidney disease, but it's still dried kibble. So I think you're actually better off working with someone who's knows how to build raw diets for kidneys, because that way then you're going to get moisture in there. And we also know that feeding raw diets to dogs is genetically and cats, genetically what they're designed to eat. So therefore you're helping other things like reducing inflammation and things like that if you do that. Other ways that they'll treat it are using alkalizing dietary alkalizers that they add to food, fluid therapy, which I recommended, and potassium supplementation, which is really interesting because in humans, your nephrologist is most likely to tell you to take potassium out. It's the opposite in pets, which is one of the reasons that if you've seen Emily and I do a video about potassium, and actually taking potassium out, unless it's warranted via a blood test, will make kidney disease worse. And that's exactly what we see in animals. They actually start to leach more potassium, and then that's why animals get, one of the reasons they get muscle loss and they become weak is because they're clearing too much potassium. So then they'll add potassium in there. If your pet's anemic, then they'll boost that up. They may use something called recombinant erythropoietin. And then if it's in late stages and your animal's not eating, they'll use appetite stimulants. And then In some rare cases, they can do enteric dialysis, but it's very uncommon that you'll find a vet doing dialysis on a pet. Generally, they'll be recommending euthanasia. So the standard of care for veterinary medicine often neglects to take into account simple lifestyle and dietary and nutritional things that we can do that are often just as effective, in fact, sometimes a little bit more, and have far fewer side effects. The other great thing about looking at preventative care and potentially treating your pet naturally is that you not only take care of the kidneys. If your pet's kidney disease is caused by chronic inflammation and you're switch them to a raw diet and add things in like fish oil, which has been shown to be very, very good for both cats and dogs with chronic kidney disease, that will actually help reduce the inflammation. So then you start to treat things like diabetes and arthritis and all of those sort of things. So we're looking, the way that we as naturopaths look is we're looking for a more holistic, encompassing approach to work with our animals and with humans, rather than a one pill that has side effects and then you have to take another pill to manage those side effects kind of model. So let's have a look at some of the things that you could do to treat your pet if they've been diagnosed with kidney disease. So the first thing I spoke about obviously was diet. So first and foremost, if you've got a dog or a cat diagnosed with kidney disease and you seriously want to help them, please take them off dried kibble. It just adds strain to the kidneys because of that dehydration, lack of moisture content in their food. There are some great websites online, and in fact, if you head over to kidneycoach.com and go to articles and then find the one about treating animals and cats and dogs with diagnosed kidney disease, I've actually got diets laid out in there of what to feed them. So you want to give your pets a kidney friendly diet, and that should be aiming at providing as much needed micronutrients to boost your pet's overall health. You do still want to reduce their protein, not so much in cats because cats are a very high protein eating species, but you're going to reduce their protein a little bit. You're going to make sure that there's no salt in there. Again, a lot of these processed kibbles and canned foods are really high in salt. We obviously want to increase potassium, but decrease phosphorus. So that can confuse people because it's a little bit different to generally the advice given in humans. So we want to make sure that phosphorus levels are low. And again, if you head to kidneycoach.com, I've actually got foods which are high and low and how you can work that out. If you can feed your pet organic food, it's even better. The fewer chemicals that their kidneys have to process, the more available energy they'll have to heal. So main foods to remove from both cats and dogs' diets is wheat and gluten. And again, your cat shouldn't be on any grain because they're carnivores. But I often find in dog dried food, it's filled with fillers like wheat gluten and just stuff that they should not be eating. And we know too in humans that gluten and dairy can destroy nephrons. So dairy I take out as well. Only because that's very high in phosphorus. Processed meats, so things like salami and luncheon hams and things like that. And then pet store treats like dental sticks and rawhide and things like that, because they're often laden with chemicals. Like with humans, like I mentioned, wheat gluten has to come out in the dog food. And, you know, if you go and pick up what you're feeding your dog and, you know, if you've got things like potato and rice and gluten and wheat, and then a whole pile of fillers and soy oil and things like that. Often there'd be like, and reconstituted meat and things like that. That's just not what they eat in the wild. And they are such highly inflammatory producing foods. So you want to make sure that they're off all of that. An example for a dog might be, you want to restrict their protein to about 10%. And again, I've got all of this on the website if you want to look at it in more detail, but say 400 grams of raw organic meat. The best meats for dogs are things like beef. I love unbleached green tripe because it is so full of probiotics. Tripe is the intestinal lining of cows. And when it says green, it just means it hasn't been bleached, which means they've removed it, and sometimes they'll bleach it to make it this nice white color, and that just kills everything. You want what they call unbleached green tripe. And that means that it's still got all the microbiome and probiotics from the cow. So that then in turn gives and passes those on to your dog. Dark chicken meat, you want to avoid breast because that's quite high in phosphorus. Kangaroo, lamb and duck, they're all low phosphorus or lower in phosphorus than other meats. Then if you're feeding raw, you always add a little bit of liver. And then I add kidney. And this is called organ therapy. So it's where you feed the organ of the organ that has diminished function. So, and that gives your body and your pet's body the micronutrients needed to support that organ. So if they were having issues with their spleen, you would feed them spleen. If, a dog, for instance, Dobermans are very prone to dilating cardiomyopathy, and that can be prevented actually by feeding your dog's heart, because it's very high in taurine, and that's one of the things that offsets that. So Apollo gets liver, kidney, heart. He gets all the organs ground up into his dog food every day in small amounts, because organ meat is very, very rich in nutrients, so they don't need a lot of it. And then you can add about 150 grams of low phosphorus vegetables and berries. So sweet potato, I don't tend to feed that because I don't think my dog's going to go out and eat potato, but sweet potato is very good if your dog has been diagnosed with diabetes, because it balances blood sugar levels. But I tend to use more things like squash, zucchini, carrots, cabbage, cauliflower, and I love adding blueberries. Because Apollo doesn't have kidney disease, I also give him things like kale and other bits and pieces, which are a little bit more higher phosphorus. But if your pet does have kidney disease, then squash, zucchini, carrots, cabbage, cauliflower, and blueberries are a good choice. Blueberries are also great because they've got an affinity for kidney tissue and are really good at detoxifying and helping support vital kidney function. So I'm a big fan of adding those in. Then I would also add 1 to 2 tablespoons of an alkalizing greens powder. Just like with humans, it's really important to make sure the diet is alkaline. So an alkalizing greens blend can be really useful here. Anything with a bit of spirulina, chlorella, things like that. In fact, there's a great book that's just coming out. I think it's called The Forever Pet by Karen Becker, and she's a alternative vet, and I have a lot of respect for her. She's got some great videos if you want to look her up. And in there, they talk about feeding your pet spirulina and how it prolonged their lives and actually prevented a whole pile of things. So I'm a big fan of that. I then would add 20 mils of fish oil. Apollo gets that every day. Fish oil, you have to make sure you get a good quality. A lot of these cheap fish oils, if you go and test them, they're just vegetable oils. So I tend to use Nordic Naturals. You can get that from iHerb. That is a very, very good brand. And I believe they engage in sustainable fishing practices as well. And then I add olive oil as well, 20 mils of olive oil. For cats, they've been, again, cats, they have a very different dietary needs because they are pure carnivores. So low protein diets that are the most commonly thing prescribed in kidney failure is still provided. Vets will still give that to cats. But the reason for this is because most meats are high in phosphorus versus the fact that cats need lower protein. And it's because, just so you know about the phosphorus, it's thought that the phosphorus binds with calcium, and then that it's more likely to clog up the kidneys and cause damage. However, the scientific support for the treatment of a low protein diet in cats isn't as strong as it is for dogs. And it's also important to remember that high protein diets, which cats require, don't actually cause kidney disease. So for your cat friends, I think if you're switching from a dried kibble to a raw diet, you don't need to be so specific about cutting their protein down. I think just taking them off a dried kibble will actually decrease the inflammation that way. But a meal example for a cat may be something like 50 grams liver, 50 grams kidney, which is that organ therapy I spoke about before, a whole egg, 100 grams of heart, and then 700 grams of ground, like things like beef, kangaroo, or lamb. They're all low phosphorus foods. And then about 100 grams of raw salmon without the bones. If you have the bones in, again, that's going to increase phosphorus. And then 15 grams of good quality fish oil. And then I would add 2 cups of water and puree it all together just so you're hydrating them properly. I don't do that, I would recommend that with the dogs because vegetable content is quite moisture rich. So they're getting their moisture that way. But you could add a bit of good quality water to the alkalizing powder and then mix that all together. And again, that makes up a big batch, and then you just feed your cat whatever you need to with that. There's a full recipe again on the website under www.kidneycoach.com, and then head to articles. And if you scroll down there, you'll find an article written about treating pets with kidney disease. The other thing that you'll have to do apart from changing their diet is you obviously need to give your pet access to water all the time through the day and night. I personally filter my pet's water. That's just to take out heavy metal contaminants and the chlorine from the water and the fluoride as well. My dogs clean their teeth with regular bones and things like that. And then if, for Polo, which is my Doberman, if he was diagnosed with kidney disease, I would actually probably think about giving him alkalized water. My filter system already alkalizes, but I would probably give him alkaline specific water just to really make sure that I'm supporting that move towards alkalinity versus acidosis to really take the pressure off the kidneys. Now, there are some great herbal medicines, and now we're getting to the exciting part. So if you're really committed to helping your pet live their best life, there is some really great herbal medicines out there that are actually very safe for dogs and cats to take. And I've waded right through all of this research, and I think I mentioned earlier, Ruby, my previous Doberman who passed away at the end of last year, she was on lots of herbal medicine and things like that. So there are plenty of herbs that you can use that are very, very safe for pets. So some of the top ones that I would recommend is Rehmannia. So Rehmannia is a Chinese herb, and it's been shown to be capable of slowing down and actually even halting the progression of kidney disease. So this herb specifically targets the kidneys, and it's great for we talk about mode of action. So some of his actions is it's kidney protecting, it stops problematic bleeding, it's an anti-inflammatory herb, it balances the immune system. It's great for pets that have gotten older and maybe quite tired all the time. So if your pet is lethargic, it's what we call an adaptogenic herb as well. So it helps them cope with stress. If you've got a pet that's anxious or stressed all the time. Rehmannia has been shown in studies to be what we call kidney protective, and it does that via a few ways. It's very powerful antioxidant and it's anti-inflammatory. And then it also helps to protect the kidneys from damage by inhibiting the expression of angiotensin II. And that's involved in the accumulation of specific proteins which actually contribute to the scarring and inflammation of the kidneys. So a really great herb. And Rehmannia also increases blood flow to the kidneys. So I spoke earlier that anything that decreases blood flow to the kidneys is going to contribute to kidney disease, and anything that improves blood flow to the kidneys will actually help prevent and slow kidney disease. So that's one of the reasons I really love Rehmannia. Astragalus, another very safe herb for both cats and dogs, is great to reduce protein loss in the urine. So if you have done a urinalysis on your pet and they've got lots of protein in the urine, astragalus is a great one to think about. It improves albumin levels, it lowers blood pressure, it actually prevents hypertensive kidney damage. So that's kidneys that are damaged by a pet with high blood pressure. Astragalus, like Rehmannia, increases the red blood cell production and hemoglobin levels, so it's great for anemia. And again, it's great for your pet's immune system, reducing risk of infection and things like that. And it's another herb like Rehmannia that helps your pet cope with stress. So again, if you've got a pet that's really prone to being stressed, astragalus is a great herb to use as well. Cordyceps is another one. So cordyceps is a mushroom, and it's a fungus that actually grows on the back of a caterpillar, which does freak some people out, but it's got a very specific history and use in chronic kidney disease. Studies show that it's got the ability to significantly decrease serum creatinine levels and increase creatinine clearance. It also reduces the loss of protein in the urine. And just like astragalus, it will increase hemoglobin levels. So a really great one. It's very, very good too if your pet is lethargic again. So the major actions of cordyceps is anti-inflammatory, antioxidant, and antifibrotic, which again is really great. It also does regulate blood sugar levels. So if you've got a pet with diabetes, cordyceps is definitely one I'd be thinking about. And then the last herb, you don't commonly see it in any of the pre-made formulas for pets. So again, if you head to our website, and I'll put it in the show notes, there's a couple of formulas that you can buy that are kidney formulas for pets that have been pre-made. And they have cordyceps, astragalus, Rehmannia in there, and a few other bits and pieces. They don't have Dan-Shen, but Dan-Shen is such a powerhouse when it comes to the kidneys. And I went right through the research, and it's safe for both cats and dogs. And the reason that I really like Dan-Shen is it protects the kidneys. It actually helps heal scarring. So part of what kidney damage is scarring to kidney tissue. And so one of the things that Dan-Shen does is reduces that and helps heal the scarring. So that will improve kidney function. It lowers blood pressure. It's a very big heart tonic, so very good if your pet has any cardiovascular linked diseases, things like dissecting cardiomyopathies in our Dobermans or in our bigger bred dogs, or if your cat has any cardiovascular high blood pressure, things like that. It is also antibacterial, anti-inflammatory, antioxidant, anti-cancer, and improves blood flow. So one of the main reasons that I like Dan-Shen, as I mentioned, it's its ability to protect the kidneys from damage. So actual animal studies, so these studies were done in animals, and this is actually when it's great to have animal studies because we're talking about animals here. And it's been shown that Dan-Shen prevented kidney injury from everything from contrast dyes all the way up to antibiotics, to iron overload and high uric acid levels. So Dan-Shen's a great herb. Yeah, so the other thing is if your pet gets poisoned, and so I had a friend whose Doberman got poisoned and they passed away. Dan-Shen is very specific for acute kidney injury. So if you have a pet that's poisoned and they go into acute renal failure, getting Dan-Shen into them in quite a decent dose quite quickly may actually help the animal recover from acute kidney disease. And what it does is it protects the renal tubules from damage and it reduces inflammation. So again, if your pet was diagnosed with acute kidney failure due to things like poisoning or medication, getting them straight onto Dan-Shen quite quickly in high doses may actually save your pet's life. Again, all those 4 herbs, I've gone right through it, very safe to use, and I've got research on that. If you're a bit unsure and your pet's, your vet's unsure about that, on the website under that treating kidney disease in pets. And then there's a link to a couple of formulas. Actually, our Kidney Prime formula, which is got those 4 herbs plus a few others like Foti and things like that. I went right through every herb in there, and that formula is very safe to give to your pets. I wouldn't use Kidney Advance, which is our nutritional formula, and that's because the research is a little bit out with N-acetylcysteine in cats in a high dose. I think in renal failure it might be okay, but I would probably just give them, and I'll get to this in the moment, I'll get to the main nutrients. So I'd probably just give the main nutrients rather than giving the Kidney Advance, and that is mainly because of the N-acetyl cysteine that we've got in there and just its safety in pets, particularly in cats. So that's herbs. Let me talk about the nutrients. And so there's 2 main nutrients that I highly recommend in animals with kidney disease. The first is coenzyme Q10. And if you jump on the website and put in natural treatments to kidney disease pets, you'll see there's a whole pile of stuff that comes up about CoQ10. CoQ10 is amazing. It's an antioxidant. It helps produce energy. It's anti-inflammatory. Again, protects the cardiovascular system and improves blood glucose. So great if your pet has diabetes as well. There's been quite a few studies done on pets using CoQ10. And in fact, the dosage of CoQ10 to use in pets is almost the same as humans. So if I had a cat, I would be wanting to get 90 milligrams of CoQ10 a day, divided into 3 doses. And for a dog, 100 to 300 milligrams a day dose, depending on size. So for a Polo, he's about 32 kilos. And if he had kidney disease, I'd have him on a minimum of 200 milligrams. If you have a great big Dane, or a dog weighing around 60, 70 kilos, you probably want that closer to 400 to 500 milligrams a day. And then if you've got a small Chihuahua or something like that, I'd still stick to about 100 milligrams a day of CoQ10. It doesn't have huge amounts of toxicity. It seems to be very well handled by animals. After CoQ10, the other one that you'll find if you do a Google research on how to naturally treat my pets with kidney disease is fish oil. And there is so much research done into omega-3 fatty acids and kidney disease. And it's one of the things that my pets are on all the time. So Apollo gets salmon bellies and sardines every day. He gets one sardine and a couple of salmon bellies. And I still add a little bit of fish oil to his food, which is why he's got a beautiful glowing coat. But just fish oil is so amazing for dogs and cats. So dogs actually lack the ability to synthesize omega-3 and omega-6. And so therefore omega-3 is actually something called a dietary essential fatty acid. And again, that's when you're giving your dogs and cats this dried kibble, it generally has no omega-3s in it. And if it does, the oils are being so processed and heated that they've become rancid. And it's in the rancidity of those oils that actually causes a whole pile of free radical damage and actually causes more damage to the pet. So if you're looking at dried food, they'll often add things like corn oil, soy oil. As soon as you heat those and process them into a dried kibble, you're heating that oil. And that what happens then is that oil becomes rancid and it oxidizes. And so therefore you're setting your pet up to be more likely to be prone to free radical damage, which will increase their risks of cancer, kidney disease, diabetes, arthritis, and a whole pile of inflammatory diseases. So the other thing to note too is that your pets, especially dogs, cannot convert plant-based sources of omega-3s like flaxseed, linseed, or canola oil, which I'd never feed anyway, into the needed active forms of EPA and DHA. So you need to give it activated. So therefore it needs to come in the form of fish oil. And you would be looking at good quality like Nordic Naturals, where they've actually got the dosages of EPA and DHA on there. So one of the things in the way that omega fatty acids work in kidney disease is it helps with cardiovascular disease. It helps if your pet's got elevated cholesterol, helps if they've got any inflammatory disorders, immune disorders, and osteoarthritis. So when a nephron is destroyed in chronic kidney disease, the remaining viable nephrons enlarge in an attempt to compensate for the diminished numbers of nephrons that are going around. That results in something called maladaptive glomerular capillary pressure. So it's increased glomerular capillary pressure. So you think about it as high blood pressure, specifically inside the kidneys. And that increased capillary pressure damages the kidney tissue further. What fish oil has been shown to do is that it significantly reduces the glomerular capillary pressure, and that protects the kidneys from further damage. So if you're giving your pet omega-3s all the time, that's actually very protective, because what it does is if there's anything that causes a spike in this glomerular filtration or capillary pressure, fish oil actually helps normalize it. And there was this great study done in dogs who had reduced kidney function, who were fed a diet rich in omega-3 fish oil, and it actually normalized their glomerular capillary pressure to a level completely consistent with dogs with normal kidney function. Another study found that dogs fed a combination of antioxidants, which are found in things like berries and super green foods and things like that, plus an omega fatty acid diet, who had chronic kidney disease. That combination slowed the progression of kidney disease better than dogs who were just treated with diet alone. So that means dogs that were just put on a straight renal diet versus dogs that were given antioxidants. So things like blueberries, CoQ10 is an antioxidant, plus fish oil, had much better outcomes than just with diet alone. Then there was a study done in cats with kidney disease. And what they did is they fed the cats a diet and then supplemented, it was a kidney diet, and they supplemented with omega-3 fatty acids. And they lived 17 months longer than the cats that were not supplemented with omega-3s. And omega-3s are just so amazing anyway for our pets. Like I mentioned, it protects their heart function. It reduces the vulnerability to developing atrial fibrillation. It also acts as an anticoagulant, so your cats and dogs are less likely to get blood clots. It's massively anti-inflammatory, so if your pet has dry, itchy skin or allergies or arthritis, omega-3s are great there. As I mentioned, it slows the progression of kidney disease, and it improves neurological development and support and cognition. So you may have noticed as your pets age, they actually get cognitive decline. They start bumping into walls, they forget where they are, they lose bowel and bladder control, all of those sort of things. And omega-3s actually prevent that and slow cognitive decline. So another great reason to give it to our pets. Yeah, and it's also great if your pet has been diagnosed with pancreatitis or inflammatory bowel disease. The omega-3s in there are really great at preventing inflammation and decreasing harmful triglycerides, which that can become a problem in things like pancreatitis and inflammatory bowel disease and heart disease. In dogs, the recommended EPA-DHA dosage range is 50 to 220 milligrams per kilo of body weight. And with cats, it's approximately 112 to 120 milligrams of combined EPA and DHA per kilo of body weight. So it's a decent dose that you want to be giving your pets. So there you have it. That is everything that I wanted to go through when it comes to treating our furry, beautiful family members with kidney disease. And I want you to remember there is so much that we can do. And I know it can be devastating if you've had a pet diagnosed with kidney disease, because we can't do things like dialysis, or we're far less likely to do things like dialysis and kidney transplants. So then you're just looking at things to slow disease. And again, in the veterinary world, that will be meaning to give lots of medications. What I'd like to suggest is that there are things that you can do that will not only just slow down the progression of kidney disease, but hopefully will make your pet's overall health so much better. And again, I want to say prevention is so much better than cure. So if you have the ability to run annual checkups with your pets, I know some pet insurances will cover that, and then start transitioning your dog or reducing the amount of dry food that they're eating, making sure they're getting a really moisture-rich diet, making sure you're taking out all that processed, highly hydrogenated oils and foods that just they're never going to eat in the wild. And yes, feeding them a raw diet is more expensive up front, but long term, you should have better health outcomes in your pets, so you're less likely to have big vet bills later. If you can't afford to do a raw diet all the time, making sure then that you either soak good, better quality kibble that doesn't have so much processed stuff. You want to make sure that it doesn't have wheat, grain, all of those sort of things. So look for grain-free foods and then soak it in a bit of water. And get your pet to eat it that way. And that way they'll have increased moisture content in their food. So I hope that you enjoyed this video. If you're as passionate about our four-legged furry friends as I am, and our two-legged birdie friends, I hope that you found it useful. If you did, give us a like. Remember to hit subscribe so you'll get notified anytime we put out new content. And if you have a comment or need some specific help, chuck it in the comment section below. I'm always looking at the comments and I will promise to get back to you. Have a beautiful day. Thanks again for being part of our kidney community. And until next time, I'll see you then. Bye.